Hi, I'm Alana, and I'm just going to go over why we use IFC and how it's used. So IFC is a type of modality that focuses on electrotherapy. So why we would use IFC is if the patient's coming in with either acute or chronic pain. Also, if the patient's coming in where they need edema control, which is also known for swelling control. Also, if the patient needs to have reduced muscle spasms or reducing muscle splinting. Some of the benefits is that it helps with reducing those pain. Also, it helps with reducing those muscle spasms and those muscle splinting, which it can be very distracting in their daily activities of their life and restricts them from doing anything without feeling that pain or discomfort. Some of the risks that are involved with IFC is if the patient is coming in with either, if they have a pacemaker, if they have any cardiac conditions, epilepsy, so having seizures, infection, also if they have open lesions, pin needles and wires, also if they have cancer, also if they have pregnancy or if they have menstrual cycles, you do not want to put it on their lower back. It can either harm the baby or the mother for pregnancy. Especially you don't want to work on someone who's in their first trimester. Those are the fatal times, and anything could happen during that time. It's the highest rate for miscarriage, so you don't want to put them at risk of losing their baby. Also, you want to check the patient's pain levels and discomfort throughout the time being. Always looking at the way that they make their facial impressions, so you can see if they're feeling any kind of pain. Also checking in, asking, is that okay? Does that feel like, is there any pain or discomfort? Please let me know at any time. I can stop or modify the treatments. Just let them know that. Basically, how we use IFC is in a quad pattern, also a clover pattern, so working across from each other. It sends electric currents between each one. Basically, you want to have, there's 4 cords, and you attach to each pad, and red goes on the top, and in accordance to the next one is diagonal, and that would be the black one. So just putting it across from each other and sending those electric currents. These are placed on the actual painful area or surrounding the painful area or along the dermatome or myotone. So remember, you want to check if the patient's able to distinguish between hot and cold. You want to make sure that their sensation is still intact. Also, you want to use a pinwheel on those very specific areas just to see if they lost any sensation or if there's altered sensation, because you want to be able to have that feedback from your patient during electrotherapy, because you don't want it to be painful, especially. So remember to ask for consent before actually performing the treatment for your patients, by going through everything like the risks, benefits, contraindications, see if they have any. That is going to be really good for you, because you don't want to put any of your patients at risk. Also, when you work with your patients, when you set up the machine for acute, it's usually preset, and it's from 80 to 150, high and low frequency. You want the vector off also. With chronic, it's 1 to 50, 1 high and 50 low. So basically, those are the things that you have to look for. So knowing if it's acute or chronic with your patients. Usually chronic is 3 months or more. Also, you can check if there's any edema, which is usually in the acuter stages. So when you set up the intensity for your patient, you see if they can feel that dermal tingling, which is the tingling that you feel with pins and needles. And then the next one is when you feel that strong contraction but not painful contraction. That's the next thing you have to record while you are working with your patient. And then you just set it up for a duration of 10 to 20 minutes, depending on the condition of your patient. Okay, and that's all.